Today we're going to be going through a quick assessment for individuals who are coming into the clinic with either low back or hip related pain. So we're just going to go through a few weight bearing assessments first. I'm going to have Casey here bend forward and try to touch her toes. I'm asking her to give me any feedback on any pain that maybe is brought on by these assessments, but we'll go ahead and just have her bend forward, try and touch her toes. And I'm looking at a few things here. I'm looking at the curvature of her spine. Come on back up for me. I'll have her face away from me. Bend forward one more time. From this direction, I'm looking at for any change in her spine angle, any sort of scoliosis or any weight shift she may do with her pelvis. And then come on back up for me. Then I can have her raise her arms straight up overhead, bend backwards. We look again at the curvature of the spine, how far her hips can move forward, and any reproduction of symptoms. And then I'm going to have her face this way and turn as far as she can to the right. And on this, I'd be looking for how much total body rotation is she able to get, and then how much of that rotation is coming from her hips versus her trunk. And then we do the same thing going the other direction. We compare for symmetries on this as well, and again, any reproduction of symptoms. Then I'll have her face me, spread her feet about hip width apart, and just go into a simple body weight squat. So I'm looking for any weight shift that she may do, any deviation of her hips and knees, and her ability to come back up. And then I'll have her go into a single leg position. I just want to look at her balance first, and then we'll look at the other side. And if she's able to do that without significant difficulty, we'll go back to the other side, and I'll just have her do a little single leg mini squat, nothing crazy. Come on back up, and we'll look at the other side. And again, I'm looking for any deviation she may have, any significant instability that may come out from that. And then the last thing we'll do is look at just a lateral lunge. So I'll have her step out to the side into a lunge position. Good. And then you can move this way, step to the other direction. Again, we can look at symmetry, look at pain reproduction there. All right. So the first thing I'm going to do is a quick range of motion assessment of the hips. So I'm going to start here. We're going to bring the right hip up into flexion. I want to get a true assessment of hip flexion, so where the pelvis wants to start to move. If I drive her knee all the way up to her chest, I can get more range of motion, but I'm getting some of that from the pelvis and the lower back. So I just do a quick check of true hip flexion, get an assessment of the end feel, external rotation, and then internal rotation. And I'm looking at range of motion, pain reproduction, and maybe any sort of compensatory pelvic movements, especially when we're dealing with individuals complaining with low back pain. So I'll do that on both sides. Then we'll go into a couple quick special tests that are very common in patients who have hip pathology. So we'll come up into flexion, adduction, and internal rotation, the fader test, and we can do that as a combined movement. Oftentimes those with intra-articular pathology will have significant pain reproduction and some mechanical symptoms with that test. And then we can come into a fader position, or a Faber position, where we drop the hip out into flexion, abduction, abduction, and external rotation here. Again, looking for how much mobility they have, as well as any pain reproduction in the anterior hip, in the posterior spine region, or in the SI joint. And we would repeat those tests on the other side. Now, in intra-articular pathology and with the spine, there can be some difficulty with active straight leg raise. So I'll have her just lift her leg up as high as she can without bending the knee. And I'm assessing her mobility there. I can passively check that. And then I can bring her down a little bit, have her hold that position. And then I just give some gentle resistance. Reproduction of pain in the anterior hip will often indicate intra-articular involvement or potentially some iliopsoas involvement. And oftentimes we'll see weakness associated with that. From there, I'm going to have her roll to her side. I'm going to do a quick check of her lateral chain as far as strength goes. So we'll have her here in a slight bit of extension. Hold this position, don't let me push down. So we're just checking her glutes. We can bend the knee, take out the glute max a little bit, hold this here, get a better check of medius. I can have her come down, lift her foot, do a quick little internal rotation check, and then lift her knee and do a quick check of external rotation in the sideline position. And this is a good way to get some palpation-based assessment. We're going to be talking later about greater trochanteric pain syndrome, so I can easily assess tenderness over the greater trochanter here, as well as the musculature around that area, anterior to it, posterior to it, and then down the lateral chain, which we'll also be talking about today. And then I can have her go ahead and roll to her stomach. From here, I can have her bend her knee. I can again assess external and internal rotation. This is in the hip extended position, whereas on her back I did it in a hip flex position. And oftentimes you'll see some differences in the available range of motion. I can come in and quickly assess passive hip extension to see if we have any anterior restrictions there. And then I can have her lift her leg, hold that position, check hip extension, and then bend the knee, and check hip extension without the hamstrings quite as involved to check her glute max. Good. And then in this position, I'll have her drop in. I'll palpate kind of the deep rotator region, and I ask her to hold this. And I'm looking for, is she able to activate that and maintain some resistance with those deep rotators? All of which are going to be important both in back pain patients as well as various hip pathologies and involvement. And then here, last few things, we'll do some quick springing of her lumbar spine to assess for any mobility restrictions there. Springing over her SI joints to see for pain reproduction. Palpation of the SI ligaments. Palpation of the piriformis. And then some palpation through the gluteals, which we also did in side lying. If needed, we can also look at hamstring attachment at the ischium, and then through the belly of the hamstring medially, and then laterally down the leg. So that's going to be our quick assessment. All of the feedback and the things I get out of that assessment will help drive the treatments as we move forward, and those will be great test, retest after we do some treatment with the Piezo wave.